Good morning, everyone, and welcome. I'm Claire Sheehan, President and CEO at the Alliance for Health Policy. It is a true pleasure to be with you today. And for those of you who joined us at last night's reception, I'm so grateful that you all came in and we had a chance to visit a little bit before today's event. Whether this is your first Alliance event or you've been joining us for many years, I'm so glad you're here. For those of you who are new to the Alliance, we are a 32-year-old organization founded by Senators Rockefeller and Danforth with the express purpose of helping educate policymakers on complex topics related to healthcare policy in a bipartisan or nonpartisan forum. In the time since our founding, health policy hasn't exactly gotten simpler, and the environment has gotten more polarized. But that's why, to many people I speak with, our mission matters today more than ever before. So I'm especially glad to be here today with you at our Signature Series Summit. Over the past decade, this flagship annual program for the Alliance has convened a multi-stakeholder community and tackled some of the biggest health policy issues of our time. We've done AI in health, a person-first health system, and mental health, just to name a few. And this year, we're taking on an issue that is relevant to every one of us, aging. Because the reality is, of course, that if we're lucky, we all experience aging. It's a near universal issue, and the systems we build today will either support or limit our ability to age with dignity and autonomy. I often get the question, go forward. I often get the question from people in our community, and whoops, I need to go back, but just so folks know, that is on our slides are over here as well. But there you go. Yeah. So I'm especially, so this is our timeline for the Signature Series for those who are interested in how we construct that. And then when we think about how we decide how the Alliance focuses on an area and why we chose aging, the answer is really pretty simple. We listen to our community. Those 30 years has helped us build a community of experts and people who care deeply about health policy. And we make it our business to do very substantive listening to those people. So when you see panels and speakers for today's summit, you can rest assured that those topics came from our insights gathering and workshops. And the speakers come recommended by our expert community. So our Signature Series fully embodies what the Alliance calls our Incubate to Educate program model. So we put listening first, and then we move into education. So that education is informed by our greatest asset, the hundreds of policy thinkers and doers who work on these issues every day. So we know that 2025 has been a year of extraordinary change for aging and health policy, and there's plenty to be concerned about. But there's still space to imagine and reimagine what we want aging in America to look like, and that's what we're here to talk about today. So a couple of the themes that we heard at our workshop that will be reflected today in our agenda. So you'll see, we heard very loud and clear that people have dated ideas of what it means to age in America today. So we're going to take that on first with our keynote and also with our first panel. We know that when we look at who we're creating policy for, we have to be very clear. You cannot create good policy if you do not know who you're creating policy for. So then we're going to move into executive insights and really talk about the relationship between innovation and policy. And we have some great speakers to join us for that. We're going to let you have lunch after that. And then we're going to look at this idea of autonomy and policy or autonomy and aging. This came through very, very clearly in our listening sessions, that autonomy is so important and that timing has a lot to do with that. So we're going to have a really interesting conversation about economics and some of the ways that we can think about having earlier conversations and preserving autonomy. Then, we're going to move from, talking about all these great ideas into an afternoon of action. So we're going to have an energizing movement break after our lunch. And then we're going to have a wonderful panel on the future of aging bright spots. We know there's a lot of people doing really interesting work out there, and there's a lot to look forward to. And that will be our last panel of the day. So when I think about what you all can take away today. There are three goals really. One is, discover a new idea, connect and learn. We are a community of learners. We are a community of thinkers, and we hope that you walk away with some new ways of thinking about things. The second is, all around you are experts and resources. So do take the opportunity to say hello and meet somebody else who shares your interest in aging policy. The strength of this organization is our community. So we love gathering folks so you have the chance to meet each other. And finally, we hope that you find some new voices and join our community yourselves. So we're looking forward to that. And there's a number of different ways you can do that we'll be sharing with you. So the thank you to our sponsors, it's so important. I want to take a moment to thank our sponsors to make this work possible, because you see their logos here on the screen. And the fact is that their investment is what allows us to make this work possible. I tell this story fairly frequently, which is that I've had people ask if the Alliance has an appropriations line item. And the answer is no. The people on this screen are what make this programming possible. It absolutely does not happen unless individuals make a commitment and work with us to create this wonderful programming. So we are very grateful and thankful that people have invested in our organization.